I hope I'm wearing enough pink. Hey everybody, it is October and you know what that means. It is Breast Cancer Awareness Month. The chance of dying from breast cancer has decreased over the past decade. While the majority of this drop is due to the improved treatments for breast cancer, an important part of the drop actually came from the awareness of breast cancer. Hello everyone, what's up? My name is Philip and I'm gonna be your nurse today. I am gonna be dedicating this whole video to breast cancer. I'm gonna go over what it is, the different types of breast cancer, the signs and symptoms, and then we're gonna go over risk factors and then just the screening process with what is breast cancer. There are two different types of breast cancer. The broad categories, one is called in situ breast cancer, and then the other one is called the invasive breast cancer. The invasive breast cancer is the most commonly diagnosed breast cancer, and that composes of about 80% of all breast cancer diagnoses. The other remaining 10 to 20% diagnosis is in situ. So what is the difference? Well, according to the American Cancer Society, in situ breast cancer is a pre-cancer that has started in the ducts or lobe but has not spread to other tissues of the breast. So invasive breast cancer is exactly what it sounds like. It's when the cancer has spread to the surrounding tissues and it's now invading into other breast tissues. Here's a picture. As you can see, ductal carcinoma in situ and lobular carcinoma in situ. It is very localized to that specific region, and you can see that it has not broken into the surrounding tissues. Now, when you look at the invasive counterparts, you can see that it has spread a little bit and it's invading other parts of the breast tissue. So risk factors. The first one is increasing age. According to this chart here, the incidence of breast cancer continues to rise sharply until about the age of 75. At around the age of 75 to 80, you can see that it kind of plateaus and then it decreases as well. Number two, race and ethnicity. In the United States, white women have the greatest risk for developing breast cancer. Black women are second at most risk. American Indians, Alaskan Natives, Hispanic women, and Asian women are least likely to be diagnosed with breast cancer in the US. So three, breast density. So women whose mammogram shows many areas of dense tissues are more likely to develop breast cancer than women who have a lot of just fatty tissue. As of now, it is unclear why dense breast tissue is more likely to develop into breast cancer. However, there is a speculation that it may be that dense breast tissue has more cells that develop into abnormal cells. Second, dense breast tissues appear white on the mammogram and fat reveals as dark. Tumors also appear white on mammograms. So according to this picture, it is very hard to diagnose and to see cancer in a woman who has dense breast tissue because it can kind of mask the cancer. It's very hard to tell. So as a result, for women with breast dense tissue, the mammogram is less sensitive, meaning that it's more likely to miss the cancer because the dense tissue is obstructing the view. Most often, women who have breast dense tissue will likely be called back to do another mammogram, and it'll be a little bit more extensive, so they're gonna position your breast in certain ways so they can get the best images. Also, fun fact, in 2023 of March, the FDA issued a ruling requiring mammogram clinic to disclose a woman's breast density status and standardize how they do that as well. 4, sex. So women are 100 times more likely than men to get breast cancer. However, there have been cases where men did have breast cancer, but very, very rare. Personal history of breast cancer. Women who have already had cancer in one of their breasts are at an increased risk of developing cancer in the other breast. Family history is an important risk factor. Out of all breast cancer diagnoses, only 20% reported that they had a first-degree relative who had breast cancer. Overall though, less than 10% of all breast cancers were from a mutated gene, such as the well-known ones, the BRCA1 and the BRCA2. If you do have these genetic mutations, your risk for breast cancer ranges from 45 to 70%. So very important for you to get genetic testing. 7, hormonal factors. So having high levels of estrogen is associated with an increased breast cancer risk. The age at which you started having periods and the age that you started menopause. So if you started menstruating at a younger age, for example, before 13 years old, your risk for developing breast cancer is higher because you've been exposed to estrogen longer than someone who started menstruating at an older age. And If you go into menopause at a later age, same thing. You have been exposed to estrogen longer than someone who has gone into menopause at an earlier age. So therefore, it increases your risk for breast cancer. Now, when I was doing research, there are several other findings that increases the risk factor for breast cancer, such as like environmental factor, diet, lifestyle, but there wasn't enough substantial evidence for me to incorporate it into this video. Okay, so next, we're gonna go over the signs and symptoms of breast cancer. So I'll put an image here, but anything with changes in texture, nipple discharge, dimpling of the skin, lymph node changes, so you're gonna have to like press around your breast, and if you feel a little lump, that could be a lymph node change. Breast or nipple pain, contracted or inverted nipple, changes in skin color, swelling, and changes in breast size. If you do have any of these symptoms, I recommend reaching out to your provider as soon as possible to come up with a plan. So screening. The goal of breast cancer screening is to detect breast cancer at an early age before a person usually discovers a lump. Breast cancer is more easily treated and more likely to be cured if it's found at an earlier stage. The gold standard here for screening for breast cancer is mammograms. So in May 2023, the U.S. Preventative Service Task Force announced that it was revising its guidelines to recommend women with an average risk of breast cancer to receive biannual mammogram beginning at the age of 40 now, instead of 50. However, other agencies and other experts recommend that you get mammograms every year. So I think just because there's no one-size-fits-all situation with this, everyone should discuss the best screening routine with your provider based on your personal circumstances, because there's a lot to take into account here. So you gotta go over family history of breast cancer, genetic makeup, and all the other factors that I listed earlier. The task force, however, emphasized that Black women especially be screened at 40 because they're more likely to be diagnosed at younger ages with more aggressive breast cancers than any other ethnic group. There are other screenings that can be done as well, so they can do the whole breast ultrasound, and you can also do an MRI. However, that's all going to be based on your provider and your personal preference. However, the gold standard is the mammogram every 1 to 2 years. So are there any risks with mammograms? There have been many technical advances in mammogram machines where they yield very, very, very low radiation. In addition, the Mammogram Quality Standards Act was developed to ensure the radiation stay as low as possible. Therefore, mammogram is completely safe to get. Painful? Most patients that I've asked, they said that it wasn't too painful, it was just discomfort because the mammogram has to press down and compress on your breast in order to get the best images. So that was the part that was causing them a lot of discomfort. However, the procedure is pretty quick. It's less than 15 minutes. They said it was bearable. So if you have done a mammogram and there is suspicions for a lump, the next step then they would want to do a biopsy just to see what that lump is about. So it could be just hard tissues, it could be fluid, or it could be cancer. But the only for sure way to diagnose breast cancer is a breast biopsy. So I hope this video was helpful. I just kind of want to bring awareness to breast cancer, especially since it's October. I actually learned a lot from, researching about breast cancer and, making this video. Hopefully, you learned something too. Let's together raise the awareness for breast cancer and keep it on the same trajectory path, and hopefully we can decrease the mortality rate by catching it as early as possible. If you have any suggestions for future videos, please leave a comment. I do enjoy making videos like this. If you like this content and you want to see more, please click on the like button and subscribe to my channel. So I'll see you around.